You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. Today, I have a very special guest who is running for the United States Congress from Texas in Texas 31. So I especially want all my guests from Texas to listen in and listen up. But I want everybody to pay attention to the fact that we've gotten to a point in our society where everyone with a platform, a microphone, or even a Facebook or Twitter account has an ability, and in my opinion, a responsibility to use their influence to affect positive change. Now, we've tried to do that with this podcast by addressing critically important health and wellness topics, especially the ones that have been in the news and have major societal impact. We've covered the Me Too movement, domestic violence, the gun violence epidemic, suicide, sex education, water health and hygiene, genetic counseling, and access to affordable health insurance, as well as many more topics. And yes, we'll be talking about coronavirus a lot in the near future. And all of these issues are those in which politicians can actually have much more influence for many more people than physicians can. So a while back, I issued an open invitation for all women who are either in or running for public office at the national level to be our guests in the ladies' room to talk about their unique perspectives on healthcare. We've had two takers so far. Dr. Kat London in episode 66, who's a family physician who was running for the United States Senate from Maine, and Lisa Mandelblatt in episode 19, who's an attorney and cancer survivor who was running for the United States Congress from my own district in New Jersey. Today, we have the pleasure of speaking with number 3, Dr. Christine Mann, a family physician who is running for U.S. Congress from Texas in District 31. Now, just a short introduction of her many qualifications. Dr. Mann is a family practice physician in Cedar Park, Texas, with 30 years of experience training and working in the healthcare industry. I didn't believe that when I saw what she looked like. She is the daughter and granddaughter of veterans, a wife and mother of 3, and was a single mother during medical school and residency. So we're definitely going to talk to her about how she accomplished that. And in addition, she was a small business owner for 11 years. In her spare time, in addition, she's been involved in a number of community service and political activities for over 2 decades, working at the local, state, and federal levels to enact policies to benefit her communities. And so it's no surprise that her campaign motto is empowering people for progress. Welcome to the ladies' room.
I'm so happy to be here. Thank you so much for having me on, and thank you to everyone who's watching.
Oh, well, it's my pleasure. Now, most of our guests are listening as true podcasts, but we are on YouTube as well. And I know everybody is dying to hear how a physician is running for Congress. But before we get into that story, tell us how you got motivated to become a physician in the first place.
Well, I actually had kind of a circular path. There was a time in my life where when I was pregnant with my first child, I wasn't too enamored of the medical field. I had some encounters with some physicians which were less than positive. And
politicians have to be so diplomatic.
Yes. But then I met a physician who, when I went into the office with my daughter, he came in the room and he sat on the floor because there were no more seats there. And I was like, wow, if you can be a doctor and be like that, yeah, then I'm going to go do this. It's something I had thought about when I was younger, kind of got turned off to. And then he kind of turned me around and showed me that I could be a different kind of physician.
Wow. So how did you manage being a single mother during medical school and residency? I was one of the doctors who said, there is no way I'm getting pregnant till after I'm finished with residency.
Well, my daughter was born, she was 6 when I went to medical school. So she had been, of course, a part of my family for a while by the time I decided to go ahead and apply. And I only applied to one school. I got accepted to one school, and I got accepted. It was a fun story. I got my notice letter on my birthday that year.
Aww.
But it was right in the middle of when I was going through a separation and divorce with my then husband. And so there wasn't any way that I was going to not do it. I recruited family and friends and, got people to help. My ex and actually his family also helped. I'm still friends with his family. He is since deceased, but I see and communicate with his family quite often. And so I had a community basically that gave me the support I needed to get through.
That whole "it takes a village" thing.
Yes, it is so true.
It is so true. And I found that becoming a mother made me much more efficient in my work.
Yes.
Because I had no choice. I
Yes.
also had no lunch.
Yes, that is so true. And, in medical school, for the first couple of years, of course, it's a lot of book learning. At least it was when I was there. It's changed quite a bit in the last couple of years. But when I was in medical school, those first years were a lot of studying, and that's something I could do while I'm breastfeeding my baby. And she was old enough that I wasn't doing that, but I did have 2 more kids after that while I was still in training. And so there's parts of it you just figure out what to do, and you pump in an empty room at the hospital, and you keep going.
Absolutely. So you are certainly a master of juggling and multitasking,
Yes,
which all of us are.
It serves me well with what I'm doing now.
And I think that there are many people that I've talked to and heard from, and people I've heard from on social media, people in the media, talking about how it's time for us to have more mothers in politics.
Yes. Mm-hmm.
Not just because we have this sense of, we gave blood, sweat, and tears to give birth to children that we're not going to send to war lightly, but also because we are used to handling all of these multitasking and juggling issues. So what made you get involved in politics?
I have always been the person at the dinner table who you had to tell to stop talking about politics. I've loved
Not at my table.
I've loved talking about politics for a very long time. And I started to be more active in politics during President Obama's first campaign. That was my first foray into working with a group here in Texas called Battleground Texas. And I was put on to the phone banks where I had to call people just out of the blue and try and get their support and get information from them. And it was a very disorienting process at the time. But I felt like it was important. And from there, I became a voter registrar in Texas. You can get trained to be able to register people to vote. So I've been a voter registrar for about 12 years. From there, I got involved with a couple more campaigns. One of the women who ran for who's running for Congress now, who ran for governor in our state, Wendy Davis. I did some block walking for her campaign. And then I started connecting to the local Democratic Party, and I have worked on countless campaigns through the local party. So it's been something I have had a passion for a long time.
And are you still practicing medicine?
I am, full-time.
Wow. So how do you do full-time medical practice and a full-time campaign? And Kat London was doing that as well, running for Senate in Maine, which proved to be a little overwhelming.
Yeah, I don't cook or clean, so my husband does all of that. But really, I have my work hours at work, and the work that I do, we don't have. We are on call, but we don't have hospital duties, so I don't have to do anything like that. And so my after hours and my lunches, I spend a couple of hours at lunch every day doing my fundraising phone calls. And then I do the same thing in the evening. And then other evenings are spent at meetings. Right now we're in the very, very final days of the campaign. So it's all block walking, knocking on doors. And
so I understand you have a primary.
Yes.
And when
correct.
Is the primary?
March 3rd. So next Tuesday.
Wow. Okay. So everybody in Texas 31, listen up. And I guess all throughout Texas is your primary is March 3rd.
No, that's correct. It's everywhere.
Okay.
The whole state.
So we don't usually have things that are tied to a specific date, but where can people go to donate to your campaign?
So it's Christine, 4congress.com. And Christine was with a CH. So Christine4congress.com. And there's a donate button right past where we talk about some endorsements that we got recently. And then there's a spot to donate.
So I usually save that to the end, but I wanted to make sure I didn't forget to get that in since we
Thank
are
you.
on a deadline.
Yes.
We're also on a deadline for a number of critically important health issues that are facing us
Yeah.
as a country. And so I wonder, first of all, do you encounter people who think it's odd that a physician is running for Congress, or do you encounter more people who feel like it's about time we had more physicians in Congress?
It was a little unusual at the beginning. In the last cycle, which I ran in the last cycle also, I made it into the runoff of the Democratic primary, and then I lost the runoff. So I had already been running in this district for this seat, and I have been now for 3 years. And so the first time it was a little odd, because there was this idea that you had to come from a certain type of background to be able to be successful with a political campaign. But that year, 2018, there actually were a record number of physicians who ran for office. And through my campaign and through some community work that I do, I have connected to a huge number of other physicians who may not be running for office, but they have decided that it is time for physicians to speak up, that we recognize that public policy has profound effects on our patients and on our communities. And I just am seeing a huge number of physicians step up and say, I'm going to talk about gun violence that affects my patients. I'm going to talk about poverty that affects my patients. I'm going to talk about immigration because people are suffering at the border. And so I have been very blessed to connect to a lot of physicians who are really starting to speak up.
So I actually thought about running for Congress in the 2016
Yes.
election, and I was thinking of being a single issue candidate, and my whole campaign was going to be doctor runs for Congress to afford health insurance for her own family.
Seriously.
Because of course, many physicians are self-employed.
Yes.
And if you're self-employed and divorced and in your 50s, you really are in a very precarious group, especially in many states. We only have one option for our health insurance, and we're paying, quite a lot. But we did get a fabulous candidate who entered the race and won, so I'm very happy with that.
That's awesome.
But I want to give you I want to give everybody some background historical information, because I just read the fabulous book about Eliza Hamilton and the founders of our country and the American Revolution. There were actually 4 physicians who signed the Declaration of Independence.
Wow, I didn't know that.
2 of whom were governors. One was the governor of New Hampshire. The other was the governor of Georgia. There are currently 17 physicians in Congress, 3 senators, 14 congressmen. But what's interesting about most of those physicians, I'm embarrassed to say, most of them are against healthcare access. Most of them are against access to care. Many of them have spread misinformation about vaccines. So that concerns me greatly. There is only one woman physician currently in Congress, Kim Schreier from Washington. And she is only the 3rd woman physician ever to serve in Congress. The first was a non-voting representative from Representative Christensen from the Virgin Islands. The second was actually my college classmate and friend, Dr. Nan Sutter Hayworth from New York. But she was only a 1-term congresswoman. And then, of course, I want to remind everybody that before Mitch McConnell, and yes, there was life before Mitch McConnell, we had a physician as the Senate Majority Leader. And that was my friend, Senator Bill Frist, who is a noted transplant surgeon who went to the Senate and said he was going to be a 2-term citizen senator and then go back to Tennessee and back to medicine, which he did. So anyway, so tell us about the really important healthcare issues for you and your healthcare priorities as hopefully our next Congresswoman from Texas.
The number one thing, of course, is making sure that everybody is covered. I've been very vocal about saying that everyone deserves coverage from the minute you're born till the minute that you are dead, regardless of your job situation, your pre-existing conditions, where you live, if you want to move to another state or start your own business, that should never be a consideration. And it's interesting to be in an arena where some people don't agree with that, where some people are opposed to the very idea that everyone should have that coverage. So I spend a lot of time talking about healthcare, obviously, but it touches on so many other facets. We have health disparities between different racial and ethnic groups. We have issues with women's health care and access to appropriate care. And when I started running the campaign, I had a long time, a woman who had been a long time political operative just say, you can't run just on healthcare. And I said, well, healthcare touches on almost every issue you can think of, from the environment, because my patients are going to have trouble with their asthma if we have pollution that goes too high. And again, gun violence. I've got 3 families who are survivors of gun violence in their families. And, the issues just go on and on. Mental health is huge. We have a terrible deficit of mental health providers. Maternal mortality
and mental health providers who accept any insurance.
Yes, that's correct. So
maternal mortality, I didn't want to cut you off on that. I do want to focus on, because of course that is a huge issue in Texas.
Yes.
And it's very interesting when you look at the data on maternal mortality, because I was surprised when I first found out that Texas is not one of the top 5 worst states in maternal mortality. I was actually shocked to find that New Jersey is number 5 in terms of the worst states. So I know we do have a maternal mortality task force here, and we are working on it. But what's interesting about Texas is pretty average in maternal mortality for white women. But when you look at women of color, then it increases by 300%.
Yes, that's correct. And we have also instituted a maternal mortality task force in Texas. I actually don't know exactly how far along they are in that process, but a couple of years ago, there was a huge amount of information in the media talking about Texas maternal mortality being equivalent to a third world country. And they went back and they relooked at the data, and it wasn't quite what they had originally said. But as a response to that, they started to create this task force, or beef it up, to see if they could identify what was going on with that. And it's still in process, but in Texas, our biggest issue is that the state chose not to expand Medicaid.
So explain that to people. What does that mean, expanding Medicaid? And first, actually explain to people what Medicaid is, because I am just staggered that most people do not understand what Medicare is and what Medicaid is. And when lots of candidates are talking about Medicare for all, or Medicare for all who need it or want it, and they don't understand what Medicare is, we're kind of, at a loss here.
Yeah, it's another reason I think that we need more physicians speaking up and trying to hold positions of power, because we get it. We get it better than most. So Medicare is the program that covers mostly elderly, 65 and above, but also covers people with certain disabilities can apply, and certain health conditions can apply. Medicaid is the coverage for low-income Americans. A huge number of disabled Americans rely on Medicaid. And in Texas, what happened is when the Affordable Care Act was passed, the legislation tried to induce states to expand their Medicaid coverage so that there were higher dollar amounts paid, higher income levels that were accepted in the plan. Right now, I think in Texas,
they were given incentives to increase this.
Yes, and they tried to make it happen legislatively, and the Supreme Court struck that down and said that it would be up to states to decide whether that or not they wanted to expand the coverage. And in Texas, I think that it's around $900 a month. If you make more than $900 a month, you are not eligible for Medicaid, and that's just an abysmal number. It's no one can survive on that. And so what happens in Texas is people that need Medicaid have to go into poverty. They can't even keep a normal job because then they don't qualify for Medicaid anymore. And so the Affordable Care Act was, one of the pieces was an attempt to induce states to expand Medicaid, and Texas chose not to do it.
So
And
expand meaning raise the
yes,
income level by which, and that's different in every state.
yes, that's
So
correct.
it,
And there are different variations in the different states that expanded it. So, it's typically thought that if you raise that dollar amount to 2.5 times the poverty level, you're going to get a lot more people who truly need it covered, and people can still continue to work and get that coverage and that protection. They're not incentivized to not work like they are on the current plan. So,
so Texas was one of 19 states
yes,
who basically said, we're not doing this because we're so against the Affordable Care Act that we're
yes.
going to cut off our noses to spite our faces, and we're not going to play ball here.
That's exactly correct. And I spent time at the Texas State Legislature this past session lobbying in favor of Medicaid expansion. I sit on a task force with State Representative John Busey, and we work to identify issues that he can create legislation for to try and pass them bills. And my area, of course, is healthcare. And one of those was Medicaid expansion. And so we put together papers, and we looked at data that would include financial data for cities and states and counties, and how many people lack insurance in different areas of the state. And so we went and we talked to, we picked the most vulnerable Republicans, people who were up for election, and we knew that their seats, they almost lost them last time. So we decided, hey, let's go talk to them and see if we can get them on board for Medicaid expansion. And they, to a person, said no. And they tried to say, well, we're worried that the federal government isn't going to continue to pay in their portion of this. And that's the other thing that people don't know, is if the state expands Medicaid, the federal government was going to pay 95% of that added expense. The states only had to cover about 5%, and still Texas said no. And it's been a huge deal here. The Texas Medical Association, all the hospital associations, everyone has told the Texas State Legislature that this was a mistake, both from a moral standpoint and from a financial standpoint, and we can't get them to budge at all. It was a straight.
So it was the legislature's decision as opposed to the governor's decision.
Yeah, if it had passed, the representative that I worked with, John Busey, he introduced an amendment to a spending bill this past session to expand Medicaid. And so we had to get, every state legislator had to go on record as to whether or not they would agree with it. And it was a straight party line vote. And so the bill didn't pass. If it had passed, we're pretty confident that the governor would have vetoed it, because he says the same thing, that he's worried that the federal government won't honor their obligation, and that's the reason they're doing it, and it's bogus.
So that's called passing the buck.
Yes, correct. Meanwhile, people are in poverty, they can't get health care, and it disproportionately is affecting women of color with this. That's how we got to this topic, is on maternal mortality affecting women of color more profoundly than it does white women.
So we do tend on this podcast to wander, but we always come back to the topic that we wandered from. So let's get back to maternal mortality.
Yeah.
And let's explain to people what are the major causes of maternal mortality? Death during or immediately after childbirth. I think it includes up to 6 months after childbirth. So what are the factors that are responsible for this? And why is this increasing so tremendously in the United States of America in the past 6 to 8 years alone?
Right. So a couple of things. I have seen maternal mortality expanded to go up to a year. So I think 6 months is the more accepted definition of that. But that's another thing a lot of people who are not in the medical field don't understand, that it doesn't have to be immediately postpartum, that there are many complications that show up after pregnancy and those months after pregnancy that contribute to maternal mortality. And the things that I am seeing have to do with blood pressure, with preeclampsia, with hemorrhage after childbirth. And it's interesting, in Texas, I was reading several months ago about an initiative to put together bleeding crash carts for women who come in postpartum who are bleeding and need emergency treatment. And the idea was to use those in rural parts of the state where we don't have access to immediate care. And so there are people looking at how do we take care of this. A lot of what happens in Texas, especially with this Medicaid issue, is that women don't get to have follow-up as long as they need to. Their Medicaid coverage continues for their child potentially, but not for them. And so they don't get aftercare for as long as they need to. So they don't get their blood pressure followed up. They don't get their postpartum depression looked at. They're not screened for other complications like pulmonary embolism and so forth. So it has a lot to do with the aftercare piece of it. That's just not being
as well as the before care piece, because
Yes.
they're not getting access to care before
Yes.
they're pregnant. Even if they do have prenatal care, there's only so much your obstetrician can fix if you haven't had health care for the past 20, 25 years.
That's correct.
During your pregnancy.
Right.
And of course, gestational diabetes,
Mhm.
diabetes during pregnancy is a huge issue. The obesity epidemic is a
Yeah.
huge problem. You mentioned rural hospitals, and one of the travesties in our country is that for a number of reasons, rural hospitals are closing down.
Mhm.
And I was shocked to find that there are many women in rural areas who have to drive well over an hour to get
Yes.
to the closest hospital, which is
Yeah.
not good if you're having an emergency
Yeah.
or if you're, having a delivery. But I was also shocked to find that the number two reason for the increase in maternal mortality rates in the United States is now said to be the opioid epidemic. So do you want
Yes.
to talk about that?
Yes. So my district, we are not seeing a huge amount of opioid issues. It's clearly in Texas, however, just overall, there is a tremendous lack of access to mental health services and to addiction services. It's very challenging to have that care provided when you do have a patient who is struggling with an addiction issue. And so there's that, plus there's the stigma attached to it. It's not treated like a brain disease, like any other illness is treated. And especially postpartum, women are not going to admit to that kind of a problem because then they're going to have their child taken away from them.
Right.
So there's a multifactorial issue with opioids, and when you add in postpartum and pregnancy, it just muddies it even further and makes it even harder for people to get the care that they need.
We did do a podcast on this issue with Dr. Elizabeth Ryan, who's a family primary care physician in New York, upstate New York. So I refer everyone to that because we've discussed that. But one of the issues I asked her was, and I will now ask you this question, is what really pisses you off about healthcare delivery from a political perspective in the United States, and how, what issue would you just love to sink your teeth in as a congressperson?
Really, it goes back to what I was talking about before. It makes me very angry that there is anyone in this country that thinks that we should not have universal coverage for every single person. That breaks my heart and makes me angry on behalf of my patients who suffer. And anyone who's been in the medical field knows what it's like to have a patient come in after years of not being able to get care. Their diabetes is out of control. They started to have complications from it. They have heart disease. And, I've got people that come to me now who say, that I'm going to call an Uber instead of an ambulance if I have an emergency because I can't afford the ambulance. And I had a gentleman recently who said that if he ever has a stroke, he does not want anyone to try and save him because he knows what the aftercare is going to look like after a stroke. And he said, I just don't have the money to be able to afford my portion of that. And I cannot bear to live in a country where that is how we deal with this. And that is my number one issue. That is the thing that I'm going to be fighting the hardest for. And on the campaign trail, I spend a massive amount of time talking about that and trying to nuance the discussion to hit people's hesitancies about it. Why do you think that this is acceptable? Tell me what the thing is that makes you opposed to doing this. And sometimes the most frustrating thing is that we have politicians who throw out plans, even on the Democratic side, that really won't get us to 100% care. And the thing that bothers me with that is that the people that will be left out are the most vulnerable. It's always going to be the people who have no voice and no access. And I just find that unacceptable.
I also find it unacceptable, quite frankly, that somebody who's a one-term congressman gets government health care for the rest of their lives for themselves and their family. That was the other reason I was thinking of running for Congress.
Yes.
I wanted that benefit. But what also upsets me is the flip side of what you were talking about.
Mm-hmm.
You were talking about all these patients who don't have care and therefore they've developed all these diseases. What about the patients who did have care, who are their diabetes is under control, their hypertension is under control? All that's all well and good until they get downsized from their jobs unexpectedly, or they get an unexpected divorce, or their partner who's providing the health insurance dies or becomes disabled and is no longer working. And what pisses me off are all of the people who are against universal health care because they think that the people who are or underinsured are just lazy and don't want to work. And they don't think that this can happen to them until it does.
Yes. And there's two big instances that I think about with that. One is the idea that that because you have, for instance, union health covered insurance, your union went and got that for you. There was a big to-do a few months ago with one of the biggest unions, and they had worked really hard to get excellent coverage. And then the union president, his daughter got cancer, and it was right in the middle of when they were having a walkout, and the union dropped everybody's health insurance as a penalty for being a part of that. And it speaks to the point that something can change anytime. People think that they're covered. People think that they are the ones that have it all figured out and nothing bad could happen to them. I read another story recently about a woman who she and her child and her husband were in a car wreck, and the husband who was carrying the insurance and the daughter died. And in the middle of all of that, trying to deal with these deaths of her closest loved ones, she was trying to figure out how she was going to work so that she would have insurance to help pay for her medical bills that she had during the wreck. And I can't even fathom that that's where we're at, that's how things run in this country.
We're often focusing on uninsured.
Yes.
We talk about underinsured, and I don't think people understand what that means also. I don't think they understand the amounts that people are paying out of pocket for premiums, as well as co-pays, as well as maximum out of pocket, which for many people that's, $6,000 to $10,000, a year. Many people have no out-of-network coverage anymore. So if you're brought to a hospital, yes, that's an emergency, but you might be seen by a doctor in the hospital who's not in your network.
Exactly.
And, you have no control over that.
Right.
Sometimes you get the bills and you're like, who is this doctor? I don't remember this person. This is not my doctor. So, there are all of those complicating kinds of issues. But I'll tell you another thing that pisses me off. is that people don't understand the relationship between Planned Parenthood and providing health care, especially for people who are underinsured. And of course, this is a huge issue in Texas, where Planned Parenthood has been defunded. So why don't you speak to that? And that will also tie us back into the maternal mortality issue.
Right. In Texas, there, as in many states, there has been a concerted effort to limit access to abortion care. And the casualty to that is just general health care for women. When you close down Planned Parenthood, you close down preventive services, you close down pap smears, you close down mammography and access to mammography. It's not just abortion care that gets shut down.
Yeah, most people don't understand
right.
that 97% of Planned Parenthood funding goes to things that have nothing to do with abortion. And many Planned Parenthood centers don't do abortions.
That's correct. And so, you included that access to birth control. Well, if we provide access to birth control, then we have fewer unwanted pregnancies, and guess what? Fewer abortions. So it's frustrating to me. Where I live, my state senator is a physician, and he has helped write some of the legislation that prohibits access to care. And he uses things that are not scientific. There were a bunch of bills in Texas that said that, abortion care providers have to have emergency privileges at the hospital, like privileges, like they have to be able to provide the care there, which is not how it works. The emergency physician provides that care, and that you had to have the hallways the size that you would have in a surgical center, and it just provision after provision after provision. And they kept saying, well, this is to protect women's health. And I just was appalled. And I ended up writing a letter to the Texas State Board of Medical Examiners saying, he needs to have his license pulled, because he's not using science. He's not using scientific fact in this legislation that he's writing. Of course, nothing happened with it. But I was so incensed that this physician was writing this legislation that is not grounded in science at all. And the U.S. representative that's sitting in the seat that I'm running for sponsors Born Alive legislation and things like that. So Texas is a real challenge, and it's not just it's state and federal. There are even cities in Texas that have written laws that say that they will never allow abortion in the city, even if it's legal across the United States. So it's very challenging here.
It's very challenging, and what I never understood is how people who are anti-abortion, and I refuse to say they're pro-life, because they're pro-death penalty and pro-war and pro not, and in favor of withholding health insurance from children, and Head Start and food stamps. What could be more pro-life than feeding the hungry?
Right.
I digress. But what I don't understand about people who are anti-abortion, if you are really anti-abortion, then be pro-contraception.
Absolutely.
And what we have seen since the institution of the Affordable Care Act is that the abortion rate has actually plummeted in the United States. It's gone down almost by 50%. So that should be viewed as a huge victory. And why is that? Because the Affordable Care Act enables women to get IUDs, which are extremely effective, allows them to get birth control pills, all with no copays. So, that is a great advance.
Yes.
In terms of maternal mortality, of course, when women have unwanted pregnancies, they're more likely to have complications of those pregnancies. And there's probably a reason that they didn't want to be pregnant.
Right.
Whether they're in an abusive relationship, or whether they're 14 years old, or whether they've been raped or assaulted. Or whether they have a horrible disease, or whether they're not ready, or they don't have a job, or they don't have health insurance.
Right.
There's lots and lots of reasons and factors. But I spent some time on your website, and tell people what the website address is.
It's Christine, 4, Congress.com.
So what I love about your healthcare plan is you talked about having, universal access and, single payer, but you also spent some time talking about a transitional time period and a transitional approach. And of course, being a woman of a certain age, you had me on your first bullet point where you talked about lowering the eligibility age from Medicare to 55. So sign me up for that. I'm all in favor of that. But you also talked about transitioning people in other ways. So why don't you speak to that issue?
So my approach on this has to do with the recognition that the patients that I serve need help immediately. And I know that whatever we do legislatively is going to take time to enact. So step one for me is making sure that people who really need the care can get that care now. So I actually have people who give me flack for this because they really want a transition faster than I may be proposing. But the transition's going to have to happen one way or another. So for me, step one is to make sure that the Affordable Care Act pieces of legislation that are in place, that the things that the current administration has done to weaken those laws, that needs to get reversed right away so people can get back to being able to afford care right away. And then we start that transition process. So for me, lowering the age to 55 and enrolling every child that is born in the United States. And I just think about
I love that approach.
Peace of mind. Think of that peace of mind. The minute your child is born, they never, ever have to think about healthcare coverage ever again.
Although I spoke to a woman physician who has, what she thought was great health insurance. She actually wrote a great book called In Shock, which I highly recommend to everyone. Great health insurance, but she had a pregnancy, which unfortunately was, highly complicated.
Oh gosh.
She had a stroke. She lost the baby. It was extremely traumatic. And she got all these bills for the baby, who they tried to resuscitate the baby, even though it was extremely premature. And so there were perinatologists involved and, intensive care unit bills, and her insurance wouldn't pay the bills because the baby was not on her insurance.
Yeah. Right.
Because the baby was not yet born.
Right. Yes.
So here she is dealing with this horrific medical situation of her own, the horror of losing this child, and of course not being able to work during a prolonged period of time. Right. And then adding insult to injury, getting, a stack of huge bills that the insurance company won't pay because they say this child wasn't on your insurance.
It's unacceptable. A lot of people in that situation, the last thing you're thinking about is getting on the phone and arguing with an insurance company, trying to make sure that all your T's are crossed and your I's are dotted. And that's just, it's unacceptable. That's why for me, that automatic enrollment at birth, so you don't have to think about it right now. In the best of circumstances, you have to enroll within 30 days in most cases. And I've had people miss that deadline. And I know 30 days probably sounds like a lot of time, but when you've got a newborn baby, that is not a lot of time. That 30 days that goes by so fast.
How do you register a baby who is dead?
Right, exactly.
So, that brings up a whole nother issue. Yeah. So speaking of a whole nother issue, we have to talk about coronavirus.
Yes.
Because this is on everybody's mind. And of course, this is a major public health scare. Yes. We've had other public health scares that we have weathered. But I think what we're really seeing in the past week is how political factors really outweigh and cancel and negate, in many cases, medical facts and medical information. Now, of course, prior to this, we see this with vaccines all the time, where politicians, including Rand Paul, who's a senator from Kentucky, who is a physician, who made some very, lukewarm anti-vaccine comments in the presidential, he was running for president and making anti-vaxxer comments. So that's unacceptable. But let's talk about coronavirus.
Sure.
and what needs to happen from a public health standpoint that certainly is not happening yet in this
Right.
country. But first, let's talk about what are the symptoms of coronavirus? What do people need to be aware of?
Yeah, from everything I've read, it's going to be similar to a cold or a flu. And it's really challenging to make a diagnosis because testing options are not available. We can test for the flu, but at least in my area, I don't have any knowledge that there's widespread availability to test for coronavirus right now. So,
Right. Basically, hospitals have to request a kit from the
yes,
CDC, and then that kit has to be sent to that hospital. My understanding is that in the entire state of California, where there's now our first case of documented coronavirus in the wild, for the
right.
entire state of California, they have 200 test kits.
That sounds right. And unacceptable. I had a little bit of this conversation with a friend of mine last night. He wrote to me and he said, I have a Republican friend who says that it's no big deal that this is going on because we can assemble an emergency task force in an hour. And I was like, wow. And my friend wanted to know how to respond to that. And I said, well, that's not true. It's not like there's people just hanging around waiting to be called for this. These are people that have jobs.
Well, first of all, we used to have
yes,
a task
exactly.
force in the Department of Homeland Security, a department
Yes.
of full-time, trained, brilliant public health officials
Yes.
who had expertise in this area, who were employed by the United States government until 2017, when President Trump fired the whole department, just downsized the whole department. So first of all those people lost their health insurance.
Yes.
Second of all, they all lost their jobs. And
Right.
third of all, the country lost a intellectual brain trust
Yes.
of people with the experience who had worked on the Ebola scare,
Yes.
who had worked on the measles outbreak scare, who know how to handle these kinds of things. And now a task force has been put together yesterday with
Right.
Vice President Pence in charge, who believes that prayer was the solution for the AIDS epidemic in Indiana that
Right.
cost hundreds of people their lives.
Yes. Yes. And I explained to my friend, I said, that the infrastructure that is gone is part of the problem. If we had had that task force stay intact for all of those years, they would have already have been, working all throughout that time on response measures for different scenarios. This is something that public health officials do on an ongoing basis, so that when a crisis does hit, they don't have to figure all of that out. They've got all of the stuff in the background, all the things that they've been working on, all the resources are in place, and then you take and ramp it up from there. And right now we're trying to do both things at the same time. And I shudder to think about the 2 years of knowledge and work that we lost in those years that task force was not in place. And you do have to have public health knowledge. I'm not a public health official. I couldn't just jump up and go be on a task force like that. I don't have that kind of training. And so it's ludicrous to say that we are where we would have been anyway, and we just saved a bunch of money because we didn't have it, and now we're just fine with this. It's ludicrous.
And Ken Cuccinelli, who's a politician who ran for governor in Virginia, is on this task force, and he famously or infamously tweeted the other day, can anybody get me access to this data? I can't get on the Johns Hopkins website because I don't have a subscription.
Right.
Are you kidding?
That was embarrassing.
It's just, if a fifth grader did that about needing an access to a website for a report, it might be cute, but that was not cute.
No.
And could you call Johns Hopkins maybe, or have an intern call?
Right. Exactly.
Like, we didn't have interns in place to collect the data. And I think what's frustrating to me as a physician, and absolutely, if they called me, I would say, no, I'm not qualified to be on this task force. I don't have a public health background either. But certainly I would have said, but can we start getting testing kits available at every single hospital?
Exactly.
And can we start telling people what symptoms to be aware of?
Right.
So
Exactly.
in terms of the symptoms being very similar to the flu, in most cases, we're not going to need to distinguish between if you have coronavirus or the flu, but we do need to remind people that so far this flu season, more than 10,000 Americans have died of the flu.
Right.
And no Americans have died of coronavirus that I know of, which is not to say that coronavirus is not dangerous. It means we have to practice good hygiene and, infection control in our daily lives for lots of other reasons. And it's all the same stuff.
Yep.
However, in addition, there are some places that, and some countries that are now limiting travel, limiting gatherings in public places. I went out to dinner last night at a local restaurant for my anniversary.
Happy anniversary.
Thank you. It's normally packed. And you can, normally, even if you have a reservation, you're waiting, 20, 30 minutes for a table at this place. And it was empty. And I looked at my partner at first when I saw the place and I said, did you rent out the whole restaurant? But the waiter told us that people in the past couple of days have just not been going to restaurants.
Wow.
Because they're concerned about, contagion.
Oh my gosh.
But I think what you can tell your Republican friend who is minimizing this is, and this is what I always say to Republican friends who minimize health issues, is, well, look at the stock market.
Right.
Obviously the stock market thinks this is a big deal. So if I can't reach you based on compassion, other people, let me just reach you based on concern for your investment portfolio or your 401k.
Exactly.
And always, in my experience, the people who don't want to provide health insurance for other people generally have 401ks and investment portfolios, even though half of Americans don't own a single share of stock.
Right.
So, I think obviously we're in free fall with the stock market because businesses are very concerned about how we're going to handle this.
Right.
Yeah. So,
well, if people aren't even going out to restaurants, I can understand that concern.
And it's very rare that I do go out to a restaurant on a Thursday night.
Yeah.
Oh my God, it's a school night. So before I let you go, are there any other issues that we should have discussed? I know we talked about a broad range of women's health issues. We talked about a broad range of things that need to happen. Certainly if I was president, Planned Parenthood would be getting the National Medal of Freedom, our nation's highest honor. I do also, speaking of what you like to tell Republicans, I do like to remind Republicans that the first president to ever fully fund Planned Parenthood was President Nixon, who said that a woman should not have to make her family planning decisions based on her income or based on the cost of care.
Right.
And he was not exactly considered a bleeding heart liberal.
Right. Right.
So any other women's health issues that we forgot to talk about?
Yeah, we kind of touched on gun violence and how it affects women. We have the Violence Against Women's Act that we can't get through the Senate. Domestic violence and women who are killed by their intimate partners, it happens way more frequently than what we really talk very much about. And I think that touches on, of course, both the gun rights issue, the gun reform issue, and of course, healthcare, because, women are in situations where they can't access mental health services and shelters and things like that because they are in fear of their life all the time. And they have a partner who has made them believe that they are worthless and that they don't have any way to get out and don't have any options. And I feel like we don't spend enough time recognizing and talking about that. And I think part of it is the stigma for women of not talking about it. It's very scary, and it makes women feel even more fearful for their lives when they have to speak out about that. And we know that pregnant women are abused more often than women who are not pregnant. And it ties into all of these other issues that we've been talking about. And I don't understand why we can't get something as simple as the VAWA passed to protect more women.
And also the closing the boyfriend loophole.
Yes, absolutely.
In a lot of this legislation. So we did discuss this in a previous podcast with a guest, and we called it Why I Stayed and How I Left.
Yep.
Because I think people who have never been in a domestic violence situation do not understand why the woman just doesn't go and leave. And, the number one reason is fear. The number two reason is finances. And the number three reason is children.
Yep.
And they're fearful that their children will be abused or harmed or killed or worse. Yeah. Of course, we one of the biggest travesties from a political influence on public health, in my view, is that the CDC was prohibited, and still is, from doing research on gun violence. So even researching the issue. But despite that, we do know that if someone has a gun, any kind of firearm in their home for any purpose, anyone who lives in that home is 12 times more likely to die of a gunshot wound.
Right.
We also do know that 41,000 Americans died last year of gunshot wounds, which is exactly the same number of women who have died from breast cancer last year. So in my view, that is a public health epidemic.
Absolutely. That's absolutely true.
And it's 4 times as many people who've died from the flu.
Yeah.
So it is absolutely a travesty, and it needs to be a priority, and it needs to be a concern of absolutely everyone. And people who don't think it's a concern of theirs, obviously have their heads in the sands, or they've been blessed to not know anybody who was shot and killed.
Right.
I'm not in that category.
Right.
So, I have 2 children who graduated from college. And when my youngest graduated, literally, I said this silent prayer as soon as they called her name for her diploma. And I was like, thank you, God, for letting both of my kids graduate from college without being shot.
I know.
Because both of them had active shooter drills that were not, they were not drills. They were active shooter situations on their college campuses.
Oh my gosh.
And that's a call you never, ever, ever want to get. So that is truly a travesty. And I think, we're seeing more and more people who are now gun rights voters.
Absolutely.
They're making that on their priority.
Absolutely.
Okay, so before I let you go, I have to ask a question I ask all of our guests about what was the most unique, interesting, memorable, or remarkable experience you ever had in the ladies' room aside from this interview.
So I'm going to talk about something that actually just happened. My campaign and I spent some time at Fort Hood. We in our district, we have the largest military installation in the world in the district.
Okay, so Fort Hood, where there also was a horrific mass shooting, and how many people were killed there?
I don't remember. It's sad to say I've lost track with all of the shootings that we've had, how many have happened in each tragedy.
So on a military base.
Yes, exactly. So we were there. We wanted to go and help pretty up the place a little bit. We did some gardening and we did some pickup of trash and all of that. And I went into the bathroom that we were able to access. And I was like, oh my gosh, these poor women soldiers, like there's this huge urinal in the middle of it. And the paper towel dispenser had been yanked off the wall. And so that's going to be my next project there, is to make it a more hospitable place for the female soldiers that have to use those restrooms. And one of the pieces for me has to do with menstrual products. I have kind of been a little bit involved with some groups here locally who package up menstrual products and provide them to homeless and so forth. And so I'm going to try and make a difference for those female soldiers when they're stuck in that yucky bathroom.
I think that's a great idea. And I will give you a decorating tip.
Okay.
I went to college at Princeton and was in the 8th class of women at Princeton.
Wow.
And we had very few ladies' rooms in many of the dorms. So they just took men's rooms and put a different sign on the door. So lots of them had urinals. And so
Yes.
what we did is we used the urinals as planters.
Oh,
And
nice.
we planted plants in the urinals.
That's awesome.
So I highly recommend
Love
that.
it.
And as far as the menstrual products, I think we should all agree that our women soldiers should be entitled to free menstrual products.
Absolutely.
And I want to give a shout out to Scotland, which is the first country just this week to pass a law saying that tampons and other sanitary products are now free for women throughout Scotland.
That is awesome.
So.
Congratulations, Scotland.
That is worldwide breaking women's health news. Anyway,
Right.
thank you so much for joining us
Yes.
in the ladies' room. We wish you every success in your campaign. And please let us know how you do in the primary. We're going to be following you on Twitter. And on Twitter, you're at Dr. Christine Mann.
Yep.
So please, everybody follow her on Twitter, on Facebook, send your contributions to her website. And, please, everybody, I know everybody in my audience is registered to vote, but
Awesome.
Please do make an effort to get everybody registered to vote. Thank you so much, and I wish you every success.
Thank you.
Take care.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.